myself and thank a few people in the room. My name is Mary Mancini. I'm the chair of the Tennessee Democratic Party, and I want to just give a tremendous amount of thanks to Yvette Strickland and Jenny Rogers. Where's Jenny? We couldn't have done this without you. Thank you so much for both of you. I also want to acknowledge some of our state election. Let me try that again. Some of our Tennessee Democratic Party State Executive Committee members who are here with us today as well. First, we have Vice Chair of the Tennessee Democratic Party, Mr. Bob Cowan. We have State Executive Committee Woman Pam Weston. And State Executive Committee Woman Merrill Rice. Also, the Tennessee Democratic Party has recently started caucuses, and basically we have 6 that have been approved by our State Executive Committee, and those caucuses give a voice to a group of people who share common denominator or common struggles or just common experience. So there are 2 of our chairs that are of our World Caucus, 2 of our chairs that are with us today. Chair of the Military Family and Veterans Caucus, Tom Keefe, is here. And particularly appropriate for what we're doing today in our Stand for Rural Healthcare Tour, Ann Quinlan, who is the chair of the Tennessee Democratic Party Rural Caucus, is here. We also have, of course, the Polk County Democratic Party Chair, Shane Reimer, is here. Thank you, Shane. Mitchell Hicks, who is the Vice Chair.
Wildcat.
Cindy Moss, Secretary. And Sally Love, your esteemed treasurer. And Sally, we really do miss you on the executive committee at the state level. But I won't repeat what you said earlier.
Someone else is better fitted for the finance committee and budget.
And the drive.
And the drive.
The back and forth connection. So I appreciate you all being out here tonight, or today rather, in this, to have this conversation with us on a Friday afternoon at 2 o'clock, one of the last Fridays of the summer. And so I appreciate it. Appreciate you spending time with us. So what we'd first like to do is call up the roundtable speakers and to make each one of us to make a statement about introduce who we are and why we are here today. Then we will really want this to be back and forth. We are up here to answer your questions. We are up here to hear your experiences, and I know we won't solve everything today, but if we could just have the conversation and change a little bit the way people are discussing this rural health care crisis, then we will it will have been a successful event. This is also not the last time that we will be doing these tours. There's so many issues that affect people in rural Tennessee that we will be coming back again, I'm sure. So Randall and Jeff and Shane, and let's see, if you would like to come up and Jenny, or did you want to come up and speak? Come on. Sure. Okay. I'm not sure if we'll need this, but. And yes, everybody come up. All the speakers come up. Randall. Why don't you go over here? I'll just go around this way. The lineup, yes.
I didn't do it. Don't have that in front of me.
If anyone did it, he did it. My name is Mary Mancini. I am the chair of the Tennessee Democratic Party. I'm here because Tennessee Democrats really believe that the rural way of life is worth fighting for. We're no longer going to stand back and watch people in rural communities continue to lose ground in the economy and continue to lose life expectancy. Now, we need rural-specific solutions to rural-specific problems, just like we need city-specific solutions to city-specific problems. But the reality is, and what the reality should be, is that no matter where you choose to live, whether it is in a big city, a small town, or a rural community, or a suburb, you should have the same quality of life. You should have the same quality of life that allows you to prosper, that allows your community to prosper, and that allows where you live to thrive. So we're just here to say the Tennessee Democratic Party has your back, and we want to hear from you, want to hear your stories, and we want to help. Again, we have your backs, and no one should lose a loved one or lose their life because they can't get to an emergency room. No one should have their family ravaged by opioid addiction without getting the help they need. Nobody should die from a urinary tract infection because they put off going to the doctor because they are underinsured or they do not have insurance. None of those things should happen in the state of Tennessee where we live. Thank you. Our next speaker is Randall Rice.
I am Randall Rice, and I've had a long association with the Tennessee Democratic Party, but right now I don't know enough. I'm also a volunteer. I've been volunteering in healthcare for many years now, since before the start of the Affordable Care Act. The state nor federal governments were doing anything at that time in Tennessee to help enroll people in insurance as it came up. So my wife and I, Merrill, sitting there, decided that in West Tennessee, we live in a rural area where there was no help, that we would get trained up to learn how to do that and help people in our area as volunteers. And that's what we did. We had to file a lawsuit to get the state to allow us to do that, but we did that. We won, and we've been enrolling folks in healthcare ever since. Then, of course, once we got involved in that heavily, then the fight to expand Medicaid came on us. Again, Tennessee said no. We took it on ourselves to decide to go to all the county commissions that we could and see if we could put pressure on the state in that way. So we did that for a period of time. And we've worked for expansion of Medicaid ever since. Right now, with all the hospital closings that started basically in 2014, we're working on a project, and Mary was gracious enough to invite me along on this tour across Tennessee. But we're working on a project with the group that I work with, the Tennessee Healthcare Campaign, to learn about these places where the hospitals are closed, they're almost closed. We want to know why they closed, what we could have done to prevent it, if anything. Some of them, not much we could have done. And if they did go ahead and close, then how is folks coping with it? So we're doing a research project to learn those things. It's funded by a grant from Greenville. And we'll be back in touch on another tour that we're doing, in addition to this one, visiting the places we've already visited some. But we want to learn what's happening. We know that lack of Medicaid expansion was a big impact on a lot of the rural places, most of the rural places. But there have to be other things too. So we'd like to know that. My colleague is here with me, Claire Sullivan, that also came down from Nashville to help learn, and she's on the team also. Thanks, Claire. Thanks for having us down, and we'll see what we can learn. Thank you.
My name's
Jenny Rogers, I don't have an official title. I've just been a healthcare advocate since I was in my 30s. I'm 58. I campaigned hard for the ACA and Insure Tennessee. But it's obvious to me, and I think everyone in this room, that, you know, our current healthcare system is just not working for so many people. We see it every day. And I just wanted to mention a couple of things that I've really noticed even in this last month, just to further prove that things are going downhill rapidly. One is, you know, so many people say to me, well, it doesn't really affect me because I have employer-based insurance. Well, in Polk County, you know, our employees for the first time in a long time are actually going to take a cut in take-home pay because insurance for the county went up 45%. And so, you know, the county couldn't take on that whole burden themselves, and so our employees are going to have, you know, they're going to see less in their paychecks going home. So even if you have employer health insurance, you know, it's going to impact you down the road eventually if it's not now. Have friends that work at Dollar General. They are replacing full-time employees with part-time employees as fast as they can because they don't have to have the high cost of health insurance for those part-time employees. A couple other things that I, you know, wanted to draw your attention to. There's a new study that just came out by the Sycamore Institute. And it was mentioned, I don't know if anybody was at the Democracy Day dinner in McMinn County recently, but it was mentioned there. You know, across 95 counties in Tennessee, 10 to 43% of Tennesseans have medical debt in collection. Here in Polk County, we are in the, we're above the state average, and I have copies of these if anybody wants it. Between 25 and 30% of our Polk County residents have medical debt in collection. That's, you know, destroying their credit rating. Guys, this system is not working. We have to do something. The other thing I noticed, and y'all probably know about, there was an article in the Tennessean that said almost 200,000 kids have been temporarily kicked off the rolls of TennCare just because they didn't file the proper paperwork. You know, that's unacceptable. You know, it's the state's responsibility to make sure that, you know, that those kids are getting, the paperwork is getting filled out correctly for them. But anyway, I hope I brought a couple of nurses friends today, and I hope they'll share some stories, and another good friend who is not insured and has fought the system hard. So anyway, I'm looking forward to hearing everybody's stories today.
Thank you, Jenny. I'm Blake Reimer, the chairman of our local Democrat Party. You can call me Shane.
And you know what, I realized what I just did, that you said that, I'm like, oh my God, I called him Shane. I know it's Shane. No wonder why they were like, people were looking at me really weirdly, like, Blake, nice to meet you.
Yeah, hey there. So for the people that are not from Polk County, I would like to say welcome to Polk County. This is like the best drive we have, I think, in the state, in my opinion, is whenever you can cross on the sides and go over the river gorge, see the water running through there, pray for no rock slides. That's what we want to do. It's just such a nice place. So welcome to our county. And as you know, we are struggling here with healthcare. So it's nice that we have a map showing down here some logistics, but the fact that our hospital closed is very concerning for me. And my role here is to sometimes be able to say things sort of bluntly that other people can't say because of their roles in the state. And this week I released a political cartoon that I had developed and paid for myself, and I put some time and effort into trying to show a reality that the responsibility of these hospital closings, not just ours here locally, but all of these across through here, is because of the lack of effort from the state legislature that refuses to expand the Affordable Care Act. Moving in that direction, and it's on them in Nashville to expand what 70% of America already has access to. Why are we being denied something in these southern states that the rest of the country has access to, that we're essentially already paying for and our tax dollars are going out of state for those things. And so as a local farmer down in Polk County, I have some chicken houses, I have some pigs, we got some cows roaming around the farm. So like our governor, if we need to do some farm videos, we're welcome to do that on my farm. I can put on, the hat and talk about what we're not doing in healthcare from the farm if we have to for Governor Lee, just to see that we're all impacted from their lack of just going along with what 70% of the country already have the basic access to. So I'm here if you want to throw some jabs, we can go back and forth on our legislature because I feel like sometimes maybe public shame is the only thing that's going to get them to do something different. And so we'll see where that goes. Thank you for coming to Polk County, though. It's a beautiful day to be here.
My name is Jeff Eastman. I'm the CEO of Remote Area Medical. We're a non-political nonprofit. We strive all across this great country to improve healthcare. If you've not heard of us, you got time to tell you a little story. Everybody here ever heard of Stan Brock? Yeah. Stan Brock, when he was a young man, came over from England to South America, Guyana, ran the largest cattle ranch in the world. When he first got there, he was 17 years old. Like all those young men, we know everything. Stan was no different. He went to the Dadnal Ranch and said, "Hey, I want to be a cowboy." At that particular time, all the cowboys were Amerindians, Native Amerindians. They put Stan on a horse in a corral. The horse's name was Cain. By the way, that's Wapashana for the devil. It already killed 2 other individuals. Stan got on the horse. The outcome was obvious. Stan thrown off, slammed against the corral. As he laid there talking and looking up at the Amerindians, he said, "Well, how far to healthcare?" And they smiled and said, "Stan, 26 miles on that road, that path you just came up." At that point in time, he said, "I've got to bring healthcare closer to people." He learned how to fly, to bring medicine from Georgetown to the interior, studied rudimentary medicine through journals. Those of you who remember Mutual of All's Wild Kingdom, Marlon Perkins discovered him on Sunday night. I always wondered why my parents went to visit Sunday night. There was Mutual of All's Wild Kingdom, visiting Ed Sullivan. We were good.
Yeah.
We could stay out of the way for 2 hours. Stan went on from there for a career in movies. He also flew aircraft all around the United States and the Western Hemisphere. At the age of 49, when I was thinking about retirement down in McMinn County and enjoying the mountains, Stan founded Remote Area Medical. Our first 7 years were outside the country, South America, all around the world. In 1992, he got a phone call from Sneedville, Tennessee. Hospital had just closed. Sound familiar? Mm-hmm. Hospital closed in Sneedville, Tennessee. Him and a group of dedicated volunteers loaded up a pickup truck and a 600-pound dental chair, went up to Sneedville, Tennessee to treat patients. That was our very first domestic clinic. Since then, we've done over 1,000 clinics all around. Communities invite us in. I hope to maybe motivate somebody to invite us to come to this part of the world. We'll talk about that later. We just were down in Cleveland a couple months ago. So that healthcare is out there. RAM fills the gaps. As we get into this conversation, we've done 13 clinics in Tennessee this year. I've got information to share with you as far as employment status, when I went to the doctor, all of that. So once again, here just to basically represent the patients that are out here in the state.
Thank you. Well, thank you again, and once again, we are all here because we want to have each other's backs. I mean, I think that's the most important thing. Traveling around, hearing stories from people or hearing people talk about healthcare as a commodity is the way we all talk about healthcare these days, right? We talk about it as, some people say, well, of course the hospital in my area closed, they weren't making money. Well, I think we all know that when hospitals first started, they were not money-making operations. They were either run by religious organizations or community, you all know that. And it was always about, staying afloat, right? Not being in the red and being in the black, but, not to make oodles of money. So we need to try to change that perception as well. The perception that people are entitled to health care and to have a good life where they can live up to their full potential. And so that's also why we're here. So, all right, we can go ahead and get started. And I do, does anybody have any questions to start us off with? Yes, Ann.
I was going to say, in response to what Lee was saying about Nashville, the governor and legislature's inability to accept expanded Medicaid, do you mind saying what you said in Fentress County the other day about the reason why the legislature did not insure Tennessee?
Yes, no, I do not mind. The political process is, obviously, the political process is that when bills are introduced, they have to go through committee, both in the House and Senate, and then the governor signs them into law, or does not sign them into law. When Medicaid expansion first came out, the Republicans were dead set against it. Bill Haslam, a Republican governor, was not, and so he rebranded it as Insure Tennessee, and every Democrat and some Republicans were behind trying to pass Bill Haslam's Insure Tennessee plan, which basically would have expanded Medicaid in the state of Tennessee. Went through a couple of different machinations, but the one thing that stuck out in my mind was one of the times that it went through committee and pretty much killed it, was in the Senate committee that was made up of 9 Republicans and 2 Democrats. And they were voting to get it out of committee so that it could go into another committee and go through the process. Well, Americans for Prosperity came around. And if you're not familiar with them, they are a right-wing organization, very well funded. And they said to these Republicans on the committee, if you vote for this expansion of Obamacare, basically is how they framed it, then we will primary you. We will put another Republican up against you in your next election. And so they all voted no. Now, they voted no, and the excuse they gave was it was going to cost too much money. Well, it was fully funded. Fully funded. So, it was a very craven political act. And that mentality, I think, still continues with some, not all, Republicans, obviously. But when you hear, I know this isn't the district, but when you hear Congressman John Rose say that not only is health care not a right, but people need to struggle in order to get health care. And the question becomes, well, how much more do people need to struggle, right? I mean, people are suffering and struggling and literally, not figuratively, but literally dying. So again, it's not just about those politicians, but it's about changing the minds of the people in the community to, yes, this is something that we deserve. This is a great country, and we choose to live in rural Tennessee, and because we choose to live there does not mean that our way of life, needs to be, or our quality of life needs to be substandard. So that was the way that's part of the reason why we got to where we are. And now we have a governor who is not interested in expanding Medicaid at all.
Thank you.
What?
Thank you.
Welcome. So I wanted to just ask Jeff, I did get your name right?
Sure did.
Okay. I wanted to ask Jeff what maybe you could tell us some of your experiences of bringing remote area medical. Like, what was Cleveland? When you brought remote area medical to Cleveland, what did that look like?
Yeah, let me just back up. We use a called community host model where communities reach out to us to come to their community. We don't charge to come to a community wherever we go. And what that looks like is you go to our website, bring RAM to your community, fill out a little form, it's my office. Send a little trifold that talks about, for example, here it's hotel rooms, location, food for the volunteers and patients. My favorite is church lady food, I call it. Baptist for breakfast, Presbyterian for lunch, and Methodist for dinner. It can be various different organizations and restaurants and stuff in the area that help support you. He had a conversation with Vicki. He said, yes, I want to step up and do it. And we send you a really thick operations manual. We've done over 1,000 of these clinics. We critique every single one. So we're getting it better all the time. I think we're best in class. In Cleveland, my favorite thing is going out in the parking lot the night before. There's an amazing community that comes together. These individuals, down in Cleveland, there's 546 people that were in the Cleveland High School. Most of them had never met each other, but they come together in the parking lot. They say, hey, who needs water? Hey, it's cold. We got a blanket, and you come together. And when you look at who these people are, okay, in Tennessee, 37% are employed. This is not the guy at the interstate with a sign and dog saying, help me. Okay? Down in Cleveland, I live in Athens, there was my contractor, his brother. Okay? They had moved back from upstate New York, and so they go to a ram clinic. So there was a great article in the Washington Post that Eli and Michael Williamson, if you get a chance to read it, followed a woman through on the medical side. By the way, 65% roughly what we do is dental, about 30% is vision, about 5% medical. Due to the fact that no matter where we are in this country, if we slip and fall and hit our head, emergency room has to take care of us. If we show up with a tooth infected, we will get some Tylenol, some antibiotics, and be told to go see a dentist. Same with if you can't see, if it's injury, they'll take care of it. If you just can't see, well, you need to go see an optician. So it's my favorite waitress in Athens. Which that convenience store you stopped at out there on Parkway. I know Polk County pretty well. It's the person that works at the Shell station up the road, okay? Or it's that family from Farner, that comes down to our clinics. We have people come to our clinics from a long distance away. I guarantee you, if I pulled the zip codes, I should have. I apologize. For Polk County, they came down to the Cleveland High School clinic. So I've been in Athens. Went out there on a Friday night, and there was the highest ranked middle school math teacher in Tennessee in line for dental care. The reason I know that is my wife's cousin. So it's in every place we go, and nothing gets county government, okay? But there'll be somebody from the county, the custodian, somebody helping in the kitchen, that will be there for care. So it's your neighbor. It's your neighbor, it's your kids. Did that answer your question?
Yeah.
Y'all roll in with like a tractor trailer set up?
Oh, yeah.
Is that it?
Yeah.
Roll into a big parking lot and be able to service people there?
Yeah, we do glasses on site. We've got a big 18-wheeler, depending on the location. It's got a vision lab down the bottom. All the dental chairs are portable. I can turn anything into a clinic. I can put up about 20 dental chairs in here. We've got the tractor trailer to challenge some places, so we've got a box truck. Everything is on rollers. We bring in, set the dental chairs up in the box truck. There's another unit that's a mobile vision lab that makes the glasses. We have thousands of glasses on site. We a couple hundred people, usually for vision, that we're going to take care of them. Dental runs about 200 to 300 people for the weekend. And we do extractions, cleanings, and fillings.
How do the demographics break down the
Where that sample wouldn't you? Okay. Roughly about 9% are retired. Okay. I pulled the top 5 questions. I can get that back to you. Okay. By the way, it's Jeff Eastman at ramusa.org for any follow-up. We're doing a great study with the University of Tennessee as far as impact. Nowadays, if you move forward, if you go forward this arena, what people want is, they won't want the end of those stories out I just told you. Okay? They're going to want hard numbers. That's what everybody's looking for. Hard numbers, facts, as you go forward. the stories, and they're passionate, the people, it's the numbers. Do you agree on that?
That who wants the numbers?
Well, just as you go forward, other organizations, legislatures, and
I do think that, yeah. But again, when, even if the numbers don't, you know, in terms of priorities, right? When do the numbers stop mattering and people's lives start mattering, right? Like
both together.
it should be, right? So,
Should absolutely.
you know, in your community, people that live here, what was it like? Can someone sort of explain what was it like before the hospital closed and what was it was like after? What about the hospital rebuilt?
Well, I'm Cynthia Moss, the chairman of our local party, and I grew up in the Copper Basin area. I'm a lifelong resident of Polk County and grew up in Duck County, Isabella, not so much in Copper Hill, but right in this area. And I was talking to Ann before the meeting started, and I said, is there anybody local that can speak to the history of Copper Basin Medical Center? And me and Ann were just standing here kind of chit-chat. We went to high school together, that's how I knew Ann. And we were just standing there chit-chatting, and you know, some things came to mind. And I apologize for my facts, but I do have the issues, okay? If you drove up Highway 64 today, for some of you, that probably seemed like the remotest possible drive you've made in ages. Turn the clock back, please, 50 years. The two-lane road was the only access west out of this area. And east would be towards Murphy, also in the mountains. North would be towards Farner, also within the mountains. Our best access from here would be south. So 50 years ago, this was really a remote area. And also, you combine the remoteness of this area with the mining industry and the mining facilities. There's much more that went on here than just merely getting ore out of the ground. There were numerous processing facilities that it took because ore left here in ingots. So from ore out of the ground to ingots, I mean, that's what it took to get the copper out of this area. So not only was this remote, but the industrial aspect of this area meant that many accidents happened in the local mining. Not to mention, in the days before antibiotics, disease, even something like childbirth was hazardous. So that was what this area would have been like before Copper Basin Hospital was established. And so you could, another thing that was important here was the men that worked the company, they called it, everything was the company. The men who worked the company were proud to belong to the union. Folks, can you believe in America that union has become a dirty word? When the men joined the union, they could negotiate a decent wage. And one of the things that the men decided to do through their union was to contribute for the common good of building a local modern hospital. You know what that's called? You know what kind of a dirty word that's called today?
Socialism.
Can you believe that people, Americans, voluntarily agreed to contribute to a common cause for the common good of their families and communities? That's a dirty word. So that's how this hospital was established. The men who worked the mines and the process, they knew how difficult life. They had seen their sisters, their wives, and their mothers suffer and die in childbirth. They knew these cemeteries around here was full of those little bitty gravestones from infant mortality. These men knew that. They had seen their co-workers killed, maimed, and not to mention the older people who couldn't get any medical care. So that's where this particular hospital came from the contributions of the men of this community through their union is what it went through. I mean, I've read a little bit about it, but you know, they had a sliding scale and they contributed out of their paycheck. Voluntarily voted yes through their union to do this. Can you even imagine anywhere in America that being done today? But at that 50 years ago, based on where this area is and the need for it, Americans were able to come together for their community. So this hospital was finally built, established. We had modern facilities for the time, good doctors. These doctors were not millionaires. This is one fact I want to apologize for, but if I'm not mistaken, the last time I looked on the internet, the richest man in Tennessee was Bill Frisk, worth $6 billion. Is he head of the Hospital Corporation of America? Excuse me for my facts, but we have got to the point where it's not enough to make a living. Some of these people have decided they've got to make a killing off of it. So, had good doctors, really good nurses, and see, that provided a lot of jobs over there at the hospital, especially for women. They had cafeteria workers that worked in the cafeteria at the hospital. They had janitors that kept maintenance workers that kept it up. Not to mention just the nurses and the doctors and so forth. And then they had satellite offices. They had the doctor's office in Copper Hill. They had Dr. Lee's office in Ducktown. Dr. Lane's office was up here where the hospital is. And that was all funded, not to make a profit, but it was funded to keep them open. I never even knew you were supposed to write a check to the doctor until I went to UTK and went to the clinic at UTK. My whole life growing up here, we just went to the doctor. Nobody ever asked us for a card. And that's, you know what that's called? Socialized medicine. A dirty word in America. It's enough to have a sick, that's things that everybody's talked about. It's bad enough to have a sick or injured child without having to worry about how you're going to pay for it. So that's kind of the history of the medical situation in this particular area here in Copper Basin. And the hospital was established and got started in 1956, and that was the year I was born. So my mother had a place local, within easy driving distance for Daddy to take her to the hospital when it was time for me to be born. So I was one of the first babies that was born over here at Copper Basin Medical Center, and then there was, born safely, which that had to be. That had to be a relief for men to know there was a place where they could take their wives when it was time for the babies to be born. And we know various things have happened through the years. It's the same with all rural hospitals. It's the same story over and over and over. So, when it comes time to make money, rural ain't the place to do it. And boom, 12 rural hospitals closed for all the same reason, can't make money. 12 more fixing to close. So I reckon Tennesseans, we're just going to have to do some hard thinking and make some hard choices at some point along the line.
Thank you. Priorities, reprioritization. Thank you so much for that. Yes.
As they introduced me, I'm Tom Keith. I'm helping set up the Veterans Council Caucus. I want to thank you for your remarks about unions. I'm a retired UAW worker. Again, I was very fortunate to have my health care. That was part of my benefits. I've been retired for 24 years. But again, that's what unions are all about. And we have to engage our neighbors, our friends, and let them know. Socialism is not a dirty word. It's people taking care of people. 35,000 veterans in Tennessee don't have any health insurance. In addition, then there's 20,000 members of veterans that don't have health insurance. Here in Polk County, it's like 1,200 veterans. That may not sound a lot, but half of them don't even have, they can't qualify for the VA, Department of Veterans Affairs, and they can't qualify for Medicare because of the political climate here. I don't have an answer, how do we get Medicaid expansion? But I know and I don't know if you can tell by my accent, I'm not here from Tennessee. But my people are from Paris, Tennessee, my grandmother's grandmother. But anyway, it's just important, not only for veterans and military family members, but for everybody. I just want to thank you people for taking your Friday and try to work on this problem. And, you know, my wife and I are going to do everything that we can possibly do. We moved here in 2015. We love the state, we love the people here, and we're going to work our hardest too to try and make sure that, especially the rural hospitals that are closing, that's an obscenity. And now I didn't know, I know 12 are closed, and now you're saying another 12 might be on the chopping block too? How long can these people in Nashville I guess they don't have a conscience, I don't know. But anyway, that's my 2 cents worth.
So we've covered, I mean, we haven't covered it completely because it's a huge issue, but the hospital closure obviously has had a huge impact on this community and other communities in Tennessee. But there's another side to this issue, which is the uninsured and the underinsured people of the state. Going through this tour, you know, when I said before up there, no one should die from a urinary tract infection because they don't want to go to a doctor because they can't afford to or don't have insurance. That wasn't just something I made up, right? That was something that a urologist in Clay County said at one of these roundtables. He said, you know, he had patients that put off going to the doctor and put off going to the doctor. He goes, by the time they get to me and finally come and see me, he goes, I don't care, you know, if I live in Salina or if they're brought to Vanderbilt or to the Mayo Clinic, it's too late. There's nothing that they can do. So that's a whole nother issue. And I'm wondering if anybody has had any experience with that, being underinsured yourself or uninsured. We would like to talk about that.
It's gonna be too shy, but I know she was diagnosed with breast cancer years ago and has been without insurance for over a year now. She lost her TeamCare because she didn't get a what was it, a patient doctor plan? A treatment plan turned in time, and it's still pending. $3,000 CAT scan that's unpaid, and just done one battle after the next, trying to get decent treatment. And also has autoimmune disease that's, you know, probably not being treated as it should be. She's without insurance. It's okay.
Randall, maybe you can speak about what resources are available. What does the gap look like in Tennessee in terms of insurance, or the landscape and the gap, and then how do you know? What are some resources? Right?
Okay. The number is big. Across our state, we have somewhere around 400,000 people that would be eligible to enroll in Medicaid if the state would expand. Medicaid, right now, if your income is under the federal poverty line, which for a single person, that's $12,140 this year. If your income is under federal poverty level, you can't buy insurance. You can't buy insurance on the marketplace, you can't buy insurance anywhere. You can't get it on the marketplace because you can't get a tax credit. You can't buy it anywhere else that can afford it if you don't make that much money. That's the population that would be covered by Medicaid expansion if we would do it. Income up to 138% federal poverty level, and that comes out to a little over $16,600. Everyone in our state that makes less than that, and that's a lot of people in Tennessee, could get free health care coverage if the governor will sign on the line. And that's all it takes. Medicaid, and we've heard the legislature talk about cooperative and all kinds of things. But Medicaid is a pretty good program. It requires a fixed set of benefits. The cost of that person that gets it is zero. And we hear doctors, or about doctors that say, well, it don't pay the bill. Well, it pays more than zero. And zero is what they're getting now. So it would save a lot of hospitals if we had it. And it's the difference between survival and not surviving. The other reason, and there's a group, if you need to get on Medicaid, TennCare we call it in Tennessee. Breast cancer is one of those items that will get you on, even if you're otherwise unqualified. There's only 2 or 3 issues: breast cancer, uterine cancer. We have a toll-free number. Tennessee Healthcare Campaign operates that can get you some help. That number is 844-644-5443.
I have TennCare for it, and they dropped because I
Now,
didn't
this
have
is
the
not
treatment
a
plan.
TennCare number.
No, this is for the breast cancer thing. The health department set me up with it.
This number will get you someone that doesn't work for the state, that's an advocate, that has to get TennCare. One of the people you may talk to is sitting right over here. That's available. What a lot of people also don't understand, and they're not taking advantage of it, is if you make over the federal poverty level of income. That can be from wages, it can be from withdrawals from an IRA, it can be from odd jobs. If you've got taxable income or income, you can claim it tax. That's federal poverty level or above. You can get insurance under the Affordable Care Act, very reasonable. And if your income is fairly low, some excellent benefits. And we've had a lot of people that didn't understand that. They had heard all the rumors from all the rumor mongers that deductibles and all of this was so high, the premiums were so high, they couldn't afford it. Well, a lot of that's people blowing smoke. They don't know, they've heard it, somebody told them that. And we enroll lots of people. We enroll a lot of people that come from areas very similar to this with little health care, and they've lost their jobs and they're getting by, but that's about it. And we enroll a lot of people who zero premium, a zero premium. And a lot of them with very little or no deductible, particularly in the lower income brackets. And the fact of the matter is, Tennessee's a poor state. It's not just Polk County. It's all across the state. My county that I live in has got a poverty level of somewhere around 20%. So that means there's a lot of them that could qualify. And the median family income is only like 32,000. So there's a lot of people who either qualify for very low cost or no cost insurance under the ACA or for TennCare. And a lot more should qualify for TennCare if we get state expanded. The other thing, let me say this, and then I'll leave it alone. When we first started really working to expand TennCare back in 2014, Merrill, the state legislature had been offered a deal from the federal government as a part of the Affordable Care Act, that if they would expand Medicaid to cover this population of folks that's under 138% of federal poverty level, the federal government would pay the entire bill for that population, 100%, for 3 years. Then each year after that, for another 4 years, the state would start picking up a little bit of that until it reached 10% for the state, 90% for the federal government. And at that level, it was free. The state said no. We can't afford it. Really? They can afford all these prisons and stuff, but they can't afford you health care. Anyway, let me get off of that. When the state said no, we can't afford it, the Tennessee Hospital Association, in their wisdom, says, if you'll do it, we'll voluntarily take a special tax assessment to pay that state's share of that bill, so it costs the state money. In fact, the state would make money off of it because Medicaid would pay the state to administer the program more than it costs them. They still say no. And that's what we do. So that's purely a political decision.
I think in this area, you could not say the state said no, just Mike Bell said no. Senator Mike Bell was in that committee that killed it in the first one.
Yes.
He voted no on that. He's always voted no, don't bring it up. So we don't have to say the state, we can say Senator Mike Bell said no.
He was one of them. I was there, so was Merrill and some others.
Has he said anything about the hospital closing?
To my knowledge, thoughts and prayers. That would be, I mean, I asked him directly last year, just do something. And we're going to try, we're going to see. So that's all I know that they've said.
Touching base on the insurance topic, when you look across the U.S., 91% of the U.S. population has health insurance. When you think about Tennessee, where we rank, and just like my patients, they come to us for free because of one, the working poor, two, they can't afford. Half of the people who come to see our clinics don't have health insurance. I don't know what is the number, the percentage is for the state, you know?
In Tennessee, statewide, the coverage is about 86.
So we're still a significant amount below the national average.
And but now in some counties like Davidson, Williamson, the percentage of uninsured in Williamson, I think is like 3 or 4%. Then you get other counties where it's up 20% or about.
When your average household income is $97,000, it's pretty easy to have insurance. I think in Polk County it's $27,000 is our average household income.
Does the 86% include TennCare and ACA coverage?
Yeah, that's some kind of coverage.
Okay.
That would be partially solid employee or whatever. The one numbers that we have not talked about, but everybody needs to understand, and depending, and keep in mind, this is an estimate because we can't know exactly, between $2.8 and $3 million every day that the state of Tennessee is giving to somebody. Kentucky, New York, California, that we're entitled to bring to Tennessee to pay for your health care facilities. That's over almost $1.5 billion a year that could be coming to Tennessee to pay for health care for our low income folks. That's going to somebody else. And it don't keep the budget down either because we don't spend it, because it's already appropriate. They don't spend it in Tennessee, they're spending it somewhere. And that's money that our creditors say, no, we don't take.
So, what were some of, since the hospital closed, since there is such a high number of folks that are uninsured or underinsured, what are some of the needs of the community?
Well, there's a lack of primary care. I'm a nurse anesthetist. I work across the line in Murphy, North Carolina, our little community hospital had to sell to Erlanger Health Systems because it was hard for the hospital to meet its debt with an increase in uninsured patients coming in. We call it charity care in the hospital. It was like $13, $14 million in a little tiny community hospital. And so it wasn't trying to make money, they're just trying to break even. And they sold to Erlanger Health Systems because that helps with buying power and costs of services and stuff. But I can tell you, working in the operating room, I see on a daily basis patients that don't have access to health care, that they come in and it's, like the urologist said, it's almost too late. They lose a leg for diabetes, or they're just sicker patients.
13, 14 million a year.
Yes.
And what happens if someone comes in like that and they get the emergency care that they need? But they lose a leg. What happens after they leave the hospital? I mean, are they?
It's a good question. There's a lack of primary care physicians or mid-level providers to take care of these patients even afterwards before. Not in addition to the lack of insurance. So it's a multi-pronged
Is it
problem.
a lack of primary care because patients can't afford to pay for it? Or is it a lack of providers?
Lack of providers. And I'm sure there is the component that they can't pay for it. And there's a lot of patients. Cindy's sister, Mary, is a physician, and she's actually at the Cherokee County Health Department. She said there are a lot of patients up here in this area that are just also afraid of the system. She's tried to enroll some of them in some kind of, indigent care, and they just, no, I don't want to be part of the system. I'm afraid to be part of the government. So there's that aspect. There's just a lot of
Mistrust.
Yes.
At the hospital in Murphy, is the increase due to people coming over the state line?
Oh, we have it. That's I worked at Fannin Hospital as well. People, go from county to county, and they don't care state line. They just go where they can get treatment.
It's either Murphy or down the River Gorge and all the way to Cleveland or to Etowah, yes, right?
Fannin County
Fannin
still has a
County.
hospital here between McCabe and Blue Ridge. But they're struggling as well.
Yeah.
Yes, I'm going to say something you mentioned earlier about people that have employer-based insurance, that they got it all and don't need anything. But I remember having employer-based insurance as a teacher for many years, and it was different from county to county. When I lived in Sevier County, my first child was born, and everything was covered. When I moved to Polk County, we had a different insurance, and it wasn't covered. I had to pay most of the cost for the hospital stay and everything out of pocket. And then also, before Affordable Care Act, if you changed from system to system, you had pre-existing conditions that would rule you out of being covered for things. And with the Affordable Care Act, all of that went away, and people have forgotten that as part of the Affordable Care Act. They think, oh, well, it's not going to affect me if we lose the Affordable Care Act. But it will if they lose coverage for pre-existing conditions and other things that came as a part of the Affordable Care Act, like covering your children until they're 25. All of those things were part of the Affordable Care Act, yes. Mhm. Yes, I remember watching that lifetime maximum amount that used to be on my insurance claim before the Affordable Care Act, even with my relatively good employer-based coverage. But in Polk County too, Cindy probably insurance with one coverage and one kind, and in the next year they'd have to change it to something totally different. And it went from year after year after year, we kept changing coverage until the state of Tennessee took over and took over the health care for the whole state. And we went as part of the policy for the whole state. But when it was just county by county, it was different every year for a while. I didn't know whether I would be covered to go to the doctor or not. Yes.
I just wanted to embellish a little bit of what Maurice had just added to it. I remember when our second child was born, I had to go to the bank to get a loan against our car so I could go pay the hospital bill for Marie and our son to come home.
Nobody told us on the way through, that he wasn't going to be covered because we were covered when our daughter was born. We actually ended up getting money back.
Wow. And that was because you were in different counties?
In different counties.
How many years apart was that, too?
3.
Oh, wow.
My daughter was born when we were living in Sevier County. She was born in Oak Ridge, but our son was born in Chattanooga, and there was 3 years difference in their ages.
And then the state took over health care for all state employees?
Yes, and I don't remember how far back that went. We were in Polk County several years before that happened, that the state took over. And then when I moved to Georgia, I had pre-existing conditions that I had to worry about. I didn't move to Georgia, but I started teaching in Georgia after I retired from Tennessee. And so I had to worry about pre-existing conditions until the Affordable Care Act came in and took care of that.
Claire, did you have something?
No, I was just going to say, I think a lot of people with employer insurance are starting to see an erosion in benefits and rise in deductibles. That's how they're dealing with the increased cost. So, another number we don't have is how many people in our state are effectively underinsured because they really can't afford to use insurance and have such a huge deductible going through first. I'm not sure that's a problem we can solve at the state level, but it's a huge issue.
As an employer, we started with that, and now I've got 46 employees, and every year it's the same topic, and the premiums keep going up, and the deductibles keep going up, and we've actually now have a teledoc system, which has been good. We'll have it where we pay for the teledoc, employees get it for free, and being able to utilize that. But it's, and every employer, every organization across the board, it's that painful time of the year when you sit down and have those discussions and everything.
I heard a comment, the lack of primary care. Are there a lot that general practitioners?
Yes, Sherwood County and Polk County, I know of. Now, Fannin County, I think, has a better amount of primary care providers.
No big clinic here?
Has it always been that way?
Basic primary.
Or is it because you lost your hospital?
It was dwindling even before we lost our hospital. We have, that I am aware of, on the eastern side of Polk County, this part of the county, 3 primary care providers. Someone correct me if I'm wrong. Dr. Hewlett, who does mostly geriatrics. Dr. Siddiqui, who would like to have been here today, but he's on out of town on vacation. And then Dr. Steve Trion down in Copperville. Jabley's in McKaysville, but so they see patients from.
And then what about the other side?
Western Polk? That more.
There's just a couple clinics.
Yeah, the COI.
There's
Regional Health
Regional Health
Corporation.
Clinic.
Bragg and Pope Walker.
But emergency care here, it'd be either Fannin County, Georgia, 20 minutes away to that ER, or Murphy, North Carolina, just half hour.
Do your ambulances run across state
They will.
But not everybody's insurance is acceptable.
Right,
If
right.
they are, they do have insurance.
The cost of ambulance out here is a whole nother
But the
discussion.
cost of the ambulance ride, right?
But where's the county, we have budget issues over how to pay for ambulance service in general. So there's only, one on this side, one on that side, or one in the middle or something like that. And then if something happens, they get called away. So access to ambulances within kind of decent time sometimes is an issue.
So the whole
Yeah.
county has 3 hospitals, frequent ambulances. I'll get my southern tongue back.
Sometimes.
Where's the other one? You know, we're unique because about 65% of our county is national forest property, right, the wedge right in the middle. So it's kind of one down. Right, yeah.
Do we have any experience of people needing an ambulance who cannot get one?
I can't give the facts, but yes, I've heard that.
That's what we heard in some of the other counties as well. We had a woman who was in charge of the EMT in Clay County, and she said there's 3 ambulances but 2 crews, and they run if they both get called out and there's a 3rd call. It's because they have to go so far, right? Crossville, Cookville, almost an hour away, right? They're tied up a lot of the time, so that is another specific problem. Who pays does the county pay for the ambulance service? Is that how it works?
I think it's a split of
Yes.
some sort, right?
Yeah, there's 4 ambulances in Polk County, 2 in East Polk, 2 in West Polk, and when one side's busy, they meet halfway down the river and station there just to help cover areas. There's not enough business in Polk County for an ambulance service to be profitable, like it's been mentioned, like some hospitals went out of business. So Polk County has to pay for the ambulance service to operate in the county, whereas say neighboring McMinn County, it's profitable enough for them there for the ambulance service to operate in the county without charge to the county because they're getting enough money from ambulance rides to make a profit. In Polk, they're not because of the geographic area, the large amount where they got to drive. So I think Polk has to kick in. I may get the sanitation and the ambulance kind of mixed up, but I think it's like $450,000 that the county commission has to pony up just in order for the ambulance just to serve the county. Now, if you take an ambulance ride, you're also billed
Yeah.
a small amount too.
I was going to mention, Yvette and I had a long conversation with Dr. Siddiqui, one of the primary care doctors still remaining. And, you know, I really think if he were concerned about his bottom line at all or making any money, he wouldn't still be here. He's just a very compassionate, community-minded person, and actually went without pay several years when they were trying to save the hospital. But he's certainly not here to make money. You know,
No. Unless you don't come to a rural area to make money, and you don't come if your wife wants them all. Or your spouse, I shouldn't say that. That's part of the problem, attracting primary care providers to rural
So now
areas.
we're down to missionary level of rural.
Yeah.
Asking for missionaries.
Is there, has there been any talk of someone setting up an emergency room? I mean, that's not.
Erlanger Health System's expanding, you know, they're putting emergency facilities in Cleveland and then Ringgold, Georgia, and, I imagine it wouldn't surprise me if they put an emergency facility here.
I've heard over maybe from the case in North Carolina.
They are, they've already opened up. So this is a really, sorry, I'm sorry.
They've opened the clinic, start, actually August 1st is opening day.
So you get funny looks because there's also this weird part where since the hospital closed, does the county even own the property anymore because the way the deed was written it might go back to a family. So we're all looking funny because there's these weird things happening with our healthcare in general. The expensive damages and who owns the property now. And can Erlanger do that? And there's doctors operating, maybe some there, but they're not paying rent to the county for it or something. I don't know. There's some weird things going on with it.
Yeah.
We could use a lot of help with the expansion of Medicaid for sure.
Or just help from the state in general, I would think.
Yeah.
You know, there's a piece of legislation that was passed in May of 2018 called the Tennessee Rural Hospital Transformation Act. Has anybody heard of that? Claire, you're shaking your head yes. Can you expound on that a little bit?
The healthcare campaign kind of followed that legislation. What it does is it just sets up a pot of money. I think it's $100,000 a year. And communities or hospitals apply to the state to get a piece of that money to hire a consultant to help them plan how to stay open. So it's, they hired a consultant from Chicago that has been visiting several hospitals. I don't apparently know reports have been issued, so it's really hard to evaluate, how important that service is and what it's going to mean for different communities. But, that is as far as, the legislature's going, at least they admit there's
Well, it's incredibly frustrating though, right? Because so it's $1 million a year, can't spend more than $1 million a year. It took them 6 months to find the company, the consulting company. Then another 6 months to get applications in for the grant money. So back in May of 2019, it was the application process ended, right? They have to put an end on those kinds of things. So the frustrating thing to me about that is it's not, you all, the community knows what needs to be done, right? And so why not take some of that $1 million and instead of spending it on a consultant? And at this point, from what I'm hearing from talking to a lot of you one-on-one, the hospital is in need of some serious repair here. The chances of it reopening again without that would be difficult, almost next to impossible. Right. So, that's a problem here. So take some of that money and put it towards actual solutions and a plan based on what you already know is the need. So while this piece of legislation may help hospitals that are struggling, like maybe the other 12 that are on the chopping block may benefit from this, it does nothing to actually help the communities and the hospitals where this crisis is already manifested in the hospital culture. So is there anything I don't know of anything, but maybe Claire or Randall or Jeff or someone knows, is there anything else the state is doing along those lines?
I was going to say that the interesting thing about that piece of legislation is that it was placed in the Department of Community and Economic Development rather than the Department of Health.
Right.
But, when I heard that, I thought, well, that's the department that, offers all these huge subsidies to companies to come in and settle in a community. Why don't they offer that money for a hospital, to be able to stay afloat, subsidize the hospital, provide incentives for someone to come in and open a hospital that's closed. I haven't heard anything like that, although I think other states do that. But we haven't taken the steps.
Our state appears to not care. Put it bluntly.
Yeah.
State government has $1 billion. $1 billion. That's a lot of money.
In a rainy day.
In a rainy day fund, it's just whatever. for what it may be needed by the state. We look at it. You need it. Instead of spending that money to come out and help communities like Polk County, eastern half of Polk County with their hospital needs, just land in a bank account. Instead, they set aside $1 million to set up a consultancy and spend the money, instead of spending it in Polk County or Clay County or Lincoln County where it's needed, it's going to Chicago, to a company called Navigant, to come in and tell you that you need a hospital. Well, they issued one of the grants to Scott County. They have a hospital that's been teetering for years. They've changed owners like 3 times. And they're on the, and they did come in, they sent a consultant in, they did whatever consultants do. Supposedly they're going to get a report back on it. That's not what they need. They need some support. They need medical pay part of the bills. They need the state to assume some responsibility for that. We've got another county, and this is another one that's teetering and hasn't made news yet because they haven't announced the closure yet. But, down on the southern border in the middle of the state, Lincoln County, they have a hospital. It's a hospital. It's fairly modern. And because they're taking so many hundreds of patients to that, it's not patients' fault because they don't have any money or anything. Their own because that's what's going on there. They would like to one of these grants too, they may get it, but that's not going to pay nothing. That's going to pay a consultant from Chicago to come down and tell them they need more paying patients. Well, they already know that. The answer is let help us get these patients. But anyway.
I wonder if either of you could speak to the status of the Star Regional hospitals in McMinn County where you're having a healthcare event tomorrow. I'm understanding that what used to be called Woods, now part of the Star Alliance, is teetering on the verge that it's only the emergency room that's currently open. Do you enlighten us about that?
I don't know. So that's another one.
So just from my point of view here, to recap what we've been told on this last little bit, there's a fund set up with $1 million in it that's going to go to pay for a consulting group to tell people what they need to do. And the consulting group, is it the same consulting group that always gets awarded the bid?
Yes, they,
Did Haslam have a cousin in Chicago?
well, it's funny
They give
that you
$1
say
million
that.
too, I mean.
So, yes, follow the money, right?
Yeah.
And that's been tried, it's been difficult to find, but of course, nothing is on their website about who is part of the company or who owns it or who works there, so it's very difficult to find that information. But yes, it's the way it's set up is that the Department of Economic and Community Development cannot spend more than $1 million per year on this program. But bids were taken from consulting companies, and Navigant was picked to do all of this consulting work. So yes, there's something weird and fishy going on there, especially, again, you all know what the community needs, and find somebody in the community to consult with. Put it in the hands of the health department, right?
Find someone we can run against Dan Allen a little bit.
Is that your House of Representatives woman? That lady right back there.
Yeah, right?
Yeah, she sure does.
Yes. Just get Mike Stewart to call her, that'll do it.
Yeah. Well, look, I think that's to get overtly political. We're kind of joking around about that, but
I'm not serious.
yeah, I know, but that's not a joking matter. Something's going on there. The reality is that when someone asks somebody, would they consider running for office, a lot of times the first reaction is no, I can't do that. But seriously, think about it. Something has got to change, and the only way we get a political will to make that effective change is if you change the person who is representing you. So, just to do a quick Google search about Mike Bell to see if he made any statement about the hospital closing, and he didn't, but in 2010 he did suggest that people use the barter system to pay for health care. So, I did run across that little gem. Huh? 10 chickens, right. So, this is what we're dealing with here. And whether it's ignorance or not having any empathy ever, or empathy left, or just thinking that everybody can, I don't know. I don't know what is going through their mind, but something has to change. So think about it seriously. If anybody thinks that they would like to challenge Howell or Senator Bell, would love to have that conversation.
Well, and probably I'm going to get political, and I represent a group that is non-political. We have to be of the work we do. Thank you.
Yeah.
One of the big reasons that we're doing this tour, and that Tennessee Healthcare Campaign is doing the research, is to keep the message in front of people. Hopefully, then they get agitated enough because they're really understanding what's going on, to put the pressure on Nashville. If the folks in Polk County and Scott County and Clay County and Fayette County and Lauderdale and all these other counties where there's lots of hospitals just take it and don't say anything, then it's going to keep happening. Well, folks, we're hollowing out rural Tennessee. You've got a beautiful region. It's going to be populated by tourists instead of residents if we don't do something, if we take towards something. We just came from Salina up in Clay County, gorgeous area, in the mountains. Dale Hollow Lake's right there, right on the top lakes in the region, and they've lost their hospital. So instead of people moving there, bringing money in, people leaving. And the town's going to die if they don't get it fixed. And it's happening all over the state. It's not just Polk County and Clay County. And it's typically rural areas. But I live in West Tennessee, in Hartland County. We have a little county hospital there. The only reason it stays there is because the big hospital system uses the satellite. Otherwise, it wouldn't be there either. But our county, and the big hospital is Madison County. There's been 6 hospitals that circle the big hospital, 6 counties that circle the big hospital that closed since 2014. So instead of people that can't pay to live in each one of these county places, now they're all going to the big hospital in Madison County. So I wonder how long it's going to be before they're able to.
Well, not just that, but football's turning people away because they're out of capacity, right? Because they're serving all those, they're out of beds.
I have a question. It got triggered when you mentioned that 65% of this county is near Cherokee National Forest. But I know we've been doing research, just trying to learn about what options might be out there. The Appalachian Regional Commission, which is kind of an agency, does cover, I think, this part of the state. I think it covers Clay County and Lincoln County for some reason. But Has anyone ever talked to them about whether there might be some federal funding that could be available, whether we invest into these communities, see if the infrastructure and, medical infrastructure of hospitals? They used to do that kind of thing, but, and they do a lot of economic development, but clearly having a hospital is the basis for bringing any other, industry or, into a community, so. I don't know if that might be an option that we're given at our state.
Well, that's the thing that's so frustrating about what you're saying, right? Like, that solution should not have to be offered by a healthcare advocate, right? That is a solution that the state officials should be working with the people, and, instead of going to baseball games and bake sales or whatever it is they do when they're back in their districts, right? They should be working with the community members to make those connections, right? Because that's who knows what doors that could open, but thank you for bringing it up, but why does it have to be you? That's so frustrating.
We have a team working on something with ARC right now, but it's more geared toward economic development, not toward healthcare or hospital growth. But we have teams forming right now to try to do something for our area as far as ARC is concerned.
The economic growth is not going to come unless we have a decent healthcare system here in the first place. It's like chicken and the egg kind of thing.
Schools that aren't following.
So, Tennessee has become a huge place for, Tom would tell you, Bob would tell you, for older Americans to come and retire here. And who, usually needs more health care as they get, is older Americans. Well, once Loudoun and Blood County are filled up, where are you going? Right. Like there is, like you mentioned, Dale Hollow Lake, there's this beautiful area. So they're not gonna come. And the fact that people, our elected people can't see that, right? That's part of the plan that we talked about, like come in here with a consultant and figure out a plan for moving the community forward for the next 25 to 50 years, not just tomorrow, right? I mean, it's incredibly frustrating. I'm sorry you're all going through this.
Like Mary said, I'm UAW retiree also, and we've got a big retiree shelter here in the state. And our company paid health care to negotiate a benefit. We give up wages for that, things like that. But what's happening is that we've had our union, UAW, take over our health care and management of it due to the fact that we wanted to be concerned on how the dollars were spent. So General Motors and Ford Chrysler for the other companies, they input money to the union for them to make the best, and how they negotiate, I'm not quite sure, but for them to make the best settlement. But what happens when we come around to enrollment, everything's changed by the healthcare providers, that they're coming to UAW, they have to sit and negotiate what benefits, what coverages are going to be covered, how much your co-pays are going up. So all of that is affected, and if the Affordable Care Act were to go away, all those guarantees of pre-existing conditions, which I have a daughter that has seriously, that, not only that goes away, but also the ability for us to maintain the health care that we have and not to cost. When I retired, I had very little co-pays. My co-pays are ridiculous now. So that keeps changing for us. So it's, even if you have employee paid health care, this matters to everybody, because that can get so ridiculous that you can have health care that you can't afford to pay the premiums and stuff like that.
Let's give every insurance company, whether it's employer-based, every insurance company, Blue Cross, Blue Shield, name them, they're in the business for profit. They've got a whole building full of green shade people scrubbing along with their pencils to find out how they can get every nickel and dime out of people. So even private insurance is there for profit. So once again, to get your other dirty word, at least it's just a break even, not try to make a killing off of us.
They care more about their shareholders than the people they're supposed to serve.
Well, that was the point. We're gonna take and hurt even more if Affordable Care that's been there now was to go away. You're gonna hurt on the premium levels. What can be negotiated to keep the benefits that we have?
Well, insurance should be against things that might happen. You might have a car wreck, a tree might fall on your house, you might be struck by lightning. But healthcare is not an event that might happen. It's something that everyone requires. You're going to age, you're going to get sick. Those things are going to happen. So insurance and healthcare should be separate.
Yep. Yes.
Just echoing something about the cost here. If you're on an employer-based program, you're probably in an 85-15 plan or an 80-20 plan, which means you give the insurance company $1, and they keep 15 or 20 cents, and you get 85 or 80 cents back to pay for medicine or visits to the doctor or whatever. I don't know how it is all around the world, but I know that most developed countries, I'm pretty sure it's not that way. I can name France. In France, it's against the law for insurance companies to keep more than 5% for their own benefit. The French people get 95 cents back. That's exactly where Medicare is. Medicare costs about 5% in operating fees. So, and it's a tax, but we don't have to be, the insurance companies don't have to be making that much money. They're really not competitive with Medicare here in our capitalist society where the market takes care of things like that. Excuse me, I'm through now.
So it never used to be that way, right? Hospitals didn't make money, insurance companies made some money, but,
During the Nixon administration, Nixon signed a law to allow hospitals and the medical profession to be a for-profit organization.
yeah, that's when everything changed.
Went downhill.
Yes. Yeah.
But we got Flo in the emu
What?
commercial. We got Flo in the emu commercial.
And as entertaining as they are, wouldn't matter if they went away.
Well, if you look back at the numbers, like when you were talking about, almost all of the hospitals in the country were owned by one of two types of entities. Either it was local government, county or city, or it was owned by one of the churches, Catholics or Methodists or Baptists or Presbyterians or whatever. They were all not for profit. But after the HMO Act, and I think that's probably what you're referring to, under Reagan, then what happened, and it probably, I guess it didn't happen here, but most of them that we see that we're having problems with now, the small county-owned hospitals sold to someone like Genova or HCA, because they got tired of managing. Well, this big company's going to take care of it. Well, they ran them for a while and pulled all the money out to take the bullet out. Then they sold it to some flying nighters. We've got it in some hospitals now. They're buying it for scams. But they pull more and more and more and more money out. And so it's just do another flip. And now we've got 13 hospitals closed across Tennessee in the last 5 years. And people like residents of Polk County, Lake County, Scott County are suffering for that. That's capitalism, folks. maybe the God that we all pray to was killing us. Just bare facts.
Well, I think look, the capitalism is a genie and it's never gonna be put back in the bottle, right? But there's a capitalist system that is also morally based, and that's what we're missing at this point. How many vacation houses do you actually use? This is really what the question is, right? Nobody is saying that if you work hard and you're successful, right, you should enjoy the fruits of that success. But somebody said it a couple of days ago, maybe it was yesterday, you know, when the CEO of a corporation is making $600 million and the workers who are making all of that, all the money for him are making minimum wage and can't afford health insurance and can't afford to live on that one job. I mean, something has to change. Something is fundamentally wrong with the system. So it's not the capitalist system. It's a capitalist system run amok, and it's greed, and it's a lack of empathy, and it's a lack of caring, and things need to change in this country. We need to elect some better people. So that the priorities will change, right? I mean, that's really the basic. That's the bottom line. Speaking of capitalism. Does anybody have anything else they want to add to the discussion? Any other questions?
Where are you going next?
Where are we going next, Trey? McMinn County. Yeah. McMinn. And then up to Hamlin. And then back to Nashville, and then we head out west. It's the same 5 stops out west, same situation. Prices. Well, thank you, everyone. Again, appreciate it. Oh, we have an announcement.
Yeah, RAM takes no government funding, just to let you guys know. Okay, we operate on the generosity of others. We'll leave some magazines up here to take with you. There's some great stories about Stan, our founder, who passed away. Just going to give you that roundabout what we do. And I would absolutely love to have somebody step up and say, hey, let RAM help fill in the gaps. We can't do the permanent stuff, but help RAM fill in the gaps here in Polk County. We go to big, small, not every clinic is 800, 900 people. We did 300 people in healthcare desert in Colorado last week. So it's not that big thing. I mean, we do clinics that's a couple hundred people.
And what's that website again?
ramusa.org to volunteer. You don't have to be medical. I'm a hall monitor, okay? That's why I started.
You're what?
A hall monitor.
Oh.
Vision over here, dental over there, okay? I have dental over there.
Thank you all.